invite you to start with the meeting. And Dr. Puri, please, would be as a moderator, would you like to start this scientific meeting, which we conducted every Wednesday? So with almost 30 participants. So please welcome and start with our Wednesday's weekly scientific meeting.
Thank you, Prof. Yati. First of all, I would like to welcome Professor Chang. Prof. Yati, the one who just welcomed you, is one of our founders of bioethic. And then here I also would like to welcome the other lecturer and professor, and also the current director, Ibu Siwi, and then the professor of bioethic, Dr. Cosmetic, and other professor and student at the Faculty of Medicine at University of Gadjah Mada. Thank you so much to allow us to have your time, Professor Chang. And then the topic is very interesting for us. Everybody here in this room wants to look younger.
Beautiful.
And certainly, that's right. We have a lot to learn from you. Allow me to read a little bit and introduce Professor Chang to all of us. Professor Zhang graduated from Yonsei University College of Medicine in 1984, and then he then became a professor at the Yonsei University College of Medicine and the head of Department of Dermatology from 2015. And also from 2015 to 2017, he is a sitting president from Korean Society for Skin Cancer. Professor Chang expertise is in skin cancers. And from 2019 to 2020, he is a sitting president for Korean Society for Aesthetic and Dermatology Surgery. Beside his busy schedule lecturing, he also performed the operation on skin cancer and reconstruction. He also gives speeches, training around the world. A couple of years ago, I know that he traveled to United States also to give some lecture and seminar. Professor Zhang is also currently a sitting board of member at the Asian Dermatological Association, and then the board member of Dermatologic and Aesthetic Surgery International League. Beside all those busy schedule, Professor Zhang is a very balanced person. He is very sporty. He climbs mountains, and then he has many hobbies. One of the hobbies that he's pursuing is the bird watching and stargazing, which is a beautiful hobby, very peaceful, and I believe it's certainly benefit Professor Zhang in his professional life that we all can learn. Perhaps we all can follow his work in his bird watching. He took a greatest picture in bird watching and then the stars. So that's what is on his CV, and then the rest of it that is perhaps more, Professor Zhang will be able to tell us ourselves beside his academic lecture that he will give to us. For the time, I will give it the time and the floor to Professor Zhang. Please, sir.
Wow, thank you for your overwhelming introduction. I thought you were talking about somebody else.
You're famous, sir. That's what we read
You
loud.
don't recognize yourself.
Can I upload my slide?
Sure. Would you share screen?
You have to give me the host.
Yes, Mbak Dewi, could you please allow Professor Zhang untuk sharing?
Mbak Dewi.
Give us a few minutes, Prof.
Okay, already.
Okay, right.
Oh, good.
Okay, go ahead.
Okay.
Ini kok masih senyum Mbak Nabila.
Let's see.
I'm sure when we finish this session, we all running to do all the treatment that Professor Zhang will recommend to us, right?
I'll be retiring. Let's see. share, right? Share screen.
Yes, sir.
There we go.
Yep.
Okay, yes.
Yes.
Okay, do you see it?
Yes.
Okay. First of all, thank you for inviting me to give a talk at this prestigious gathering. And I give my appreciation to my dear friend, Miss Puri. And she introduced myself to you already, so I guess I can skip that part. And I have no conflict of interest. There will be some commercial products that are going to be introduced in my talk, but I have no conflict of interest. I guess I can skip this part. And I was going to tell you that I'm not a traveling salesman trying to sell you some kind of product, but she already told you about that. And my major field of interest is skin cancer and reconstruction. So what I do is I remove the skin cancer from patients using a specialized technique called Mohs micrographic surgery to remove the tumor completely, to increase the cure rate, maximize the cure rate, and to minimize the size of the defect. That would allow the patient to have the minimum amount of scarring and preserve the function after it's all done. Unfortunately, this patient had a very, very advanced skin cancer, which resulted in almost complete loss of his upper lip and part of his lower nose. And this is after reconstruction. And although aesthetically it's not so symmetric and pleasing, but functionally he is able to speak and eat and do whatever with his mouth. So this is kind of work that I do. And for this kind of patient with a melanoma on the cheek, remove the melanoma. And the surgery was done in conjunction with head and neck surgeons to remove the lymph nodes in the neck and repair the defect. And when all the removal of the tumor is done, the patient ends up having ectropion, a pulling down of the lower eyelid. So then I correct that ectropion with a trippier flap from the upper eyelid. And this is what the patients get. Aesthetically, it's okay, but because of the procedure done on the upper eyelid of the affected eye, she has a bigger and more younger looking left eye than the right eye. Right eye is the intact. We didn't do anything on the right eye. And later, she requests the same kind of surgery on the right eye to make it look symmetric. So this is how I got into cosmetic surgeries. I didn't do cosmetic surgeries from the start, but in order to correct any asymmetry of the face and eyes after skin cancer surgery, I had to do some kind of procedures to satisfy the patients. And there are some diseases which results in atrophy of the face. This young boy was affected by a disease called scleroderma. And because of the thinning of the skin and loss of the subcutaneous fat on the affected side of the face, now he has depressed areas on the right side of his forehead, cheekbone, and chin. And now he has asymmetry, which is mentally very depressing for a juvenile boy. In order to correct this, we use fat on his abdomen or thighs or wherever he has an ample supply of those. And we inject fat in those affected areas. And after 7 injections, he gained back his symmetry, maybe not 100%, but up to 90% of the symmetry back. So this is how we help the patients cosmetically. So this is why Ms. Puri asked me to do lectures on skin cancer or skin aging, and also includes cosmetic procedures that I do. So I would like to tell you about the cosmetic side, which is my secondary job or hobby, you can say. And I'd like to share with you what I have learned during my 30 years of practice. And this is where I work at. It's Yonsei University located in Seoul, Korea. And Severance Hospital is the affiliated hospital to Yonsei University College of Medicine. And this hospital was founded in 1885 by an American missionary, and it's the oldest Western hospital in Korea. The hospitals that are seen in the picture don't look old. They're not 130 years old. The main hospital was built in 2005, and the cancer hospital has been built in 2015, so they're pretty recent. We also have in the background, we have cardiovascular hospital and several other hospitals. So it's a big complex, which has about 2,500 beds. It's a big complex, and I work at the main hospital. This has been a dream of humans since long time ago. In 1546, a painter called Lucas Cranach the Elder drew a picture of a fountain of youth. It has been in stories, but he made it into a graphic showing the elderlies and sick people taking a bath in the fountain of youth, and then coming out on the other side as healthy and young-looking individuals. So this has been a dream. It has been a dream for many, many centuries. Now, in the latter 2015, late 20th century, maybe for the last 20 years of the 20th century, this has gradually been realized by many people in many aspects. You all know who this is, right? So nobody can escape this rule of reality. But even this young girl and a beautiful young lady and an elegant elderly lady cannot escape this reality. But Asian people don't age as fast as the Caucasians. She's a very, very famous singer in Korea. This was when she first debuted, when she was about 20 years old. And this was in her early 40s. And this is now in her mid-50s. You can compare with the previous photos that the Asian skin don't age as fast as the Caucasians. There are many factors, but the biggest factor is the presence of pigment. Luckily, people in Indonesia and us Koreans, we have natural sunscreen in our skin, the melanocytes, very, very effectively working melanocytes that block UV light from damaging our skin. And you will see later how the UV light damages the skin. But since we have natural sunscreen in our skin, we don't age as quickly as the Caucasians do. And they have a very bad habit among the Caucasian people. I was once in Waikiki Beach in Hawaii, and I saw that all the people had beach umbrellas, but all the Asians were gathered under the umbrella, preventing to keeping themselves away from sunlight. But most of the Caucasians put their stuff under the umbrella, and they were out in the sunlight, baking themselves under the sun. That's a very bad habit in terms of skin aging, skin cancer formation. Skin aging is a phenomenon a reduced ability of cells to recover, and gradually they lose the normal function. It's due to genetic factors and environmental factors. Even people who share the same environmental factors, they can age differently due to genetic factors. And some people are born with better skin than the other. If you look at a person at age 60, 70, and they have never been to a dermatologist to receive any kind of treatment, and some people have more aging spots than the other. It's a genetic factor, and you cannot do anything about it, but you can certainly do something about it. And when we talk about skin aging in medical terms, we use intrinsic aging, which is the genetic factor, and extrinsic aging, which is mostly affected by the environmental factors. And one of the biggest factor that we can avoid is photoaging by UV light, and smoking is one of the biggest environmental factors. Stress, as doctors, we tell patients to minimize the stress as best as possible, but in real life situations, it's not always possible. You cannot really avoid stress. And it depends on the personality. Even if you're under the same stressful situations, it depends on the people, how much they respond to that kind of situation. And it's a very difficult factor to control. Nutrition, of course, you can control it. A lack of sleep is pretty much related with the stress factor. And also, heat has something to do with aging. We didn't know about this, but this has been scientifically proven about 10 years ago that exposing yourself to too much heat can age your skin more. But I'm not quite sure about this because this has been a very, very experimental laboratory experiment. Because if this is true, a lot of the Koreans and Japanese people should be aging faster because we like hot baths. Especially in cold winters, we like taking long and hot baths and in hot springs. But this is not always true. In controlled experiments where the volunteers were irradiated with heat sources very partially in their skin, and that part of the skin was biopsied to find out if the heat has affected experimentally and experimentally affected the aging factors in the skin. But if you experience a hot sauna or a hot bath, hot spring bath in cold weather, the overall feeling that you get is very, very pleasing, and it feels as if the hot bath is relieving you of all the stress. So it may be a balance between the stress that's relieved by the heat and the heat itself that's affecting the skin. So overall, the heat factor may not be affecting the skin as much as you would think, as it's observed in strict laboratory situations. So it's a balance. And extrinsic aging, I reversed this. Sorry about this. This is intrinsic aging or chronological aging. I reversed it. Sorry about that. And intrinsic aging is something that nobody can escape from. It's a cellular aging, and part of our DNA shortens with each replication of cells. So this shortening of telomere, a part of the DNA that's called the telomere, causes our cell to become aged. and mutation of mitochondrial DNA, which is crucial in the breathing of the cells, and oxidative stress by the reactive oxygen species, and especially in female, hormonal reduction after menopause, they all can be a factor for the chronological aging. And for the extrinsic aging, as I told you, the ultraviolet is one of the biggest factors, as well as smoking and ozone and insufficient nutrition and lack of sleep and God knows what. For some of you who are not familiar with the structure of the skin is composed of 3 layers. Epidermis, the barrier between the outer environment and the inner side of our body. And here's the dermis, which is the most resilient part of the skin. And this is what the leather products are made of. About 80% of this dermis is composed of type 1 collagen, which is very, very resilient. And this is what makes the leather products so strong. And below that, we have subcutaneous fat. And this is what people want to get rid of the most, but this has beneficial effects. And these 3 layers are what are the components of our skin, and they all age in their own way. I'll skip this detailed structure. And young human skin has many layers of epidermis in a very convoluted and a very wavy pattern. The junction between the epidermis and dermis is composed of, is called a basement membrane, and it's a very wavy joint area between the 2 structures. And as you age, the thickness of the epidermis becomes less. It becomes very thin, and the waviness of the junction of the 2 areas becomes flattened out. And you lose many components in the dermis as you age. So the components that gives the resilient and elasticity to our skin is the dermis, as I told you. And as you lose this property, your skin becomes lax and wrinkly. This is a very famous photo from a journal called New England Journal of Medicine. And this young Caucasian male has been a truck driver for almost 30 years. And the left side, which is the window side, left side of the face is very, very wrinkled because of the UV effect. And the right side, it mainly shows intrinsic aging. There are a very small amount of fine wrinkles, and you lose fat as you age. So you get the grooves here in the cheeks, and you have some fine wrinkles around the mouth. But the left side, which was affected by the sunlight, is really bad. So there are many signs of skin aging, but it all comes down to wrinkles and pigmentations and elasticity. These are the things that we have to reverse in order to rejuvenate the patient. And a lot of the skin aging studies has been done in twins. There's a place called Twinsburg in state of Ohio in US, and they have Twins Day Festival every year. So a lot of the twins from all over the world, they're all identical twins. They gather in this small town, and a lot of the people in medicine gather here to do some comparison studies. And a team of doctors conducted interviews in 186 pairs of identical twins during this festival, and they assessed facial features, overall perceived twins' age, and a lot of factors that could tell how old the patient is and how old the patient looks. And they've assessed possible environmental aging factors because identical twins are assumed to have the same intrinsic factors. So we can eliminate the intrinsic factor between the two twins, and we can only analyze the environmental factors affecting the aging process. And as we have seen in the truck driver photo, the smoking, it's a UV. One of the factors, one of the environmental factors was smoking, and the smoking, UV, and smoking, they all affect the reactive oxygen species, which activates a pathway, a cell signal pathway called MAP kinase pathway, and eventually it activates an enzyme that breaks down the collagen and elastic fibers that gives elasticity and resilience to the skin. So finally, you have wrinkling and sagging of the skin because of these smoking and UV factors. There are typical features of people who have smoked for a very long time. They have brittle hair. They have more pimples and blemishes, and they have higher risk for developing acne because the components in the smoke suppresses our immune system. They have and it causes, the smoking causes constriction of the smaller blood vessels, so the perfusion to the skin becomes worse than non-smokers. And of course, their teeth become yellowish due to the staining caused by nicotine and tar. And long-term effects results in balding, losing hair, and because of the sagging of the skin, they have less firm eyelids and baggy eyelids on the lower eyelid as well. And in general, most of the facial features sag down. So this is not what people want, but some people just cannot stop smoking. And if you compare the twins who has been smoking, if you compare a pair of twins, and one of them has not smoked and the other has smoked for a very long time, it eventually 10 years of smoking difference led to 2-year increase in perceived age. So if one of the twins has smoked for like 30 years, that twin will look at least 6 years older than the other one. Look at this twin, and she has a 20-year greater smoking history than this twin here. You can see the fine wrinkles around the mouth, and look at the sagging of the lower eyelid, and there are more wrinkles here on the forehead. And you can see that both of them enjoy sun tanning. They're very well tanned. So the UV factor can be negated in this pair of twins. And the smoking is the biggest factor, biggest environmental factor for the aging difference of this twin. This twin also. This twin on the right, the B, she had 40-year greater smoking history than twin A here. So the perceived age difference was 8.25 years, but she seems to have tanned more. Maybe a little bit of a difference in the environmental factors. and this is another twin with they had exactly the same environmental factors. They lived in the same township, and their hobbies were same, and their outdoor activity was almost the same. So UV factor, and you can look, you can see that their skin are not tanned at all. So they don't enjoy sunbathing. And the only difference in the environmental factors is smoking. And look how much wrinkles she has. So if there's anybody who smokes in this audience, just remember the photos and be sure to stop smoking for your lungs and for your skin. And UV radiation causes a lot of things in our skin, and UVB, the shorter one, penetrates less, and it induces sunburn. But UVA, which is composed of longer wavelength lights, it penetrates deeper. So the component of the UV that affects skin aging is mostly UVA. UVA affects the dermis. So UVA in the long term breaks down the collagen in elastic fibers. UVB, on the other hand, affects the epidermis. Of course, epidermal factor is one of the factors that affects skin aging, and it causes surface features, surface changes, but the loss of elasticity and sagging is due to the UVA. And this UVA, because of its long wavelength, it penetrates windows. So if you're sitting in a car and you're getting all the sunlight, it's not safe to assume that the window is blocking off the UV. It's only blocking off UVB, and UVA is penetrating. So if you remember the photo of the truck driver, he doesn't have any pigmentary abnormalities on the wrinkly side. It's only the wrinkles that's affected by the UVA. Even in cloudy days, about 40% of the UV, especially the UVA range, it will penetrate the cloud and affect your skin. So it's safe to apply sunscreen even on cloudy days. As we have seen in the diagram before, UV causes the enzymes that breaks down the collagen elastin to be overproduced, and those enzymes break down the resilient component of the skin, the collagens and elastins. So that's how we get wrinkly skin from too much UV exposure. And this twin has difference in UV exposure. They're 61, and Lady A is much younger looking than, it's like mother and daughter, not twin sisters. So that's how much difference they have. They have a perceived age difference of 11.25 years, more than 10 years difference. But I think it's, you can say like more than 20 years difference. And people will nod. Hormone replacement therapy. If you pass menopause and you have reduced levels of estrogen, that can also affect our skin to age more. And these two ladies have a hormonal replacement therapy difference. And this lady is like almost more than 7 years older than this lady here. So hormone replacement can also affect your skin, not only your well-being sensation. And in order to protect your epidermis, which is the outermost layer of your skin, and is called the barrier, the epidermal barrier. And it's a real barrier between the outer environment and your inner body. And if it becomes too dry, the most important component of that barrier, the stratum corneum, this is the keratin layer, and this epidermis is composed of many layers, and the most deeper layer of this epidermis is called basal layer, and they continuously divide and they move upward to lose the viability, but in the end they form a layer which is called the keratin layer, and this layer is very, very important in protecting our skin. And if this layer, if you look at this layer with the electron microscopy, it's like a brick wall. The dead cells act as bricks, and there are intercellular components, which is composed of lipids, and they hold these bricks together. And so it's called a brick and mortar model. So if you use too much detergent, if you scrub your skin, the detergents will remove the lipids, and too much scrubbing will remove this brick layer. So your normal brick wall begins to crumble. And if they crumble, you lose the barrier, and you're going to have all kinds of trouble affecting your skin, like itching and constant fissuring of the skin, and your skin becomes really dry. And if it becomes too dry, it also activates the enzymes in your skin that will break down the normal connective tissue layer. So there are lots of moisturizers to correct this problem. Some people have more drier skin than others, so they cannot produce so much lipid in their body. It's uncontrollable. So you have to supply that lipid component from the outer layer. So there's so many products, and there are no rules in choosing the product. You just try them out, and you pick whatever's good for you. It's good for the Indonesians because you don't have cold weather, but in temperate weathers, like in Korea, we have a very, very cold and dry season in winter, and people come in, and we have a very bad habit of bathing because Korean people likes to scrub their skin because it temporarily feels so nice if you scrub, but especially in winter, it's going to cause a lot of trouble to dry up your skin, and they feel a lot of itching and stinging because of the loss of the epidermal barrier. And it's our job to replace that with a lot of moisturizer use. And the aging of the skin appears in a lot of ways. They may cause surface changes, or they may cause structural changes. Structural changes are mostly caused by intrinsic and extrinsic factors. Retaining ligament attenuation is an intrinsic factor, or it can be a habit. If you do too much strenuous exercises, and that will cause retaining ligaments to become loose, and that will cause structural changes. And subcutaneous fat thinning may be a result of intrinsic aging, but it also may be a result of excessive diet. And dermal thinning is affected a lot by smoking and UV light exposure. So it can be a combination of extrinsic and intrinsic aging. Surface changes are usually caused by more environmental changes, environmental factors than than intrinsic factors, mostly by UV. And as I told you, the genetic factor may lessen this process, but the most conspicuous factor is the UV. This lady has some surface changes, the fine wrinkles on the face, and the pigmentation here, and pigmentation is like all over the face, and fine wrinkles. These are all surface changes, but she also has deep grooves that are caused by loss of subcutaneous fat, and here's a ligament that holds the lower eyelid firm, but as that ligament loosens, you develop a deep groove under your eye, which increases the bagginess. And you have like nasolabial fold, and you get jowls, the protrusion of the chin, of the mandible, mandibular margin area. So in order to improve these changes, there are lots of ways. Some can be medical, and some can be surgical. And I will talk about the cosmeceuticals later on in the latter part of the talk. And my favorite medical product is the retinoids. This retinoid is is basically vitamin A. It's a different product of vitamin A, and this has been found to be very, very effective medication to prevent and to treat the aging changes. And it was first produced as an anti-acne medication in early 1970s. And it has been found that the elderly people, in adult type acnes, people first used this for treating acne, but they reported to the doctors that they're losing their fine wrinkles. So people began research on the anti-aging effect of the vitamin A products. And this group of researchers did topical retinol application in 36 volunteers of more than 80 years of age. And they have observed the volunteers for 6 months. And you see, and this study was to evaluate only the intrinsic aging side of the aging phenomenon. You can see significant reduction in intrinsically aged skin on the inner arm, where it's not affected by the UV light. This is another volunteer who shows almost complete loss of the fine wrinkles on the area where the retinol was applied for 6 months. So you can see that it's a very, very effective medication. And actually, in laboratories, when researchers develop a so-called anti-aging medications, retinol is always the positive control. They always compare it because this is a well-known product, which has been proven scientifically to restore or prevent skin aging. They use the retinol as a positive control to assess the effectiveness of the newly developed medication. So the retinol decreases the tactile roughness, and it also improves the fine wrinkling, and overall severity is significantly reduced in all the volunteers. This is one of my first retinoic acid patient, and she wanted the overall aged appearance of her face to be improved. So I first gave her retinoic acid, the vitamin A cream that we use. And this is her after nothing but retinoic acid application for 5 months. It's like a younger sister coming back to hospital for evaluation. Side of her face, you can see that a lot of the pigment has been lightened up, if not completely gone. The most darkest component here has improved like more than 50%, more than half of it's gone. And some of the lightly colored areas have cleared completely. And you can see the bagginess of the lower eyelid has improved greatly because of the restoration of the elasticity and resilience of the connective tissue. Here's a close-up of her right lower eyelid, and you can see how much it has improved and how much she has lost the fine wrinkles and the pigmentations, and also the flush, the redness caused by dilatation of the capillaries. And as the capillaries, small blood vessels lose their elasticity, they become bigger, they become dilated, and your overall skin becomes flushed and reddish. But as the collagen and resilient components are restored with vitamin A, your blood vessels regain the elasticity and they become like smaller in diameter. So you lose the redness. This is another individual with fine wrinkles of the neck, fine vertical wrinkles of the neck. This horizontal wrinkle is a structural component of the neck, which she had since she was a very young individual. So it requires a different kind of procedure to make this clear up, to clear this up. But these fine wrinkles can be cleared with application of the retinoic acid. And the other means to improve the changes, the surgical means. And we have many aspects and many procedures that we can do. There's a very simple procedure called microdermabrasion, including dermal needling. And people have found out that if the skin has been damaged in very controlled and acute way, as the skin heals, the thinning and loss of elasticity that's caused by aging and all the environmental factors can be reversed and can be treated. So one of the first procedures that people did was to just completely grind off the skin with a mechanical grinder or a laser that can peel off the skin completely, or you can use like acids in a very controlled way, phenols or trichloroacetic acid, and you can damage the skin to a certain depth where it will remove all the superficial aged skin, but it will not affect the deeper regenerative component. If you damage the skin too deeply, it will not heal up properly, but it will result in horrible scarring. So that's a very, very delicate balance. So you have to know how much you can damage in order to improve the skin quality. And one of the safe way is to, the traditional way is to just grind off the whole skin, but if people have been searching for a safer way to do it. And one of the ways is to use a micro needle. And you can control the depth of the damage by controlling the depth of the needle. It's a very simple procedure in concept. And it's damaging your skin in a very controlled depth and not the full face. It leaves normal skin between these needle marks. So the skin heals very fast without any scar formation. And this will result in regenerating the normal components of the skin. And it also improves the phenotype of the skin, so it will look younger. The fine wrinkles in the cheek area and the dilated, the pores will be smaller, and the patient in the lower photo has lost a significant amount of the chickenpox scars. And also the wrinkliness of your body can be improved with microneedling. And we can use lasers in a very controlled manner. And this is a very, very popular procedure today. And there's so many different kind of lasers that we can use, and they all affect the skin in different ways, but towards one common goal, to make the skin look younger. So to completely grind off the skin, which is called ablative rejuvenation, we use a laser called CO2 laser or Erbium-YAG laser, or fractional rejuvenation that affects the skin in the same way as the microneedling does. We can use different kinds of wavelengths of the laser light, or you can use a laser that melts down the fat layer, and it will cause the tissue tightening within the skin layer. So this kind of laser procedure is a little different in concept from the other two on the top, which treats the skin from above through the epidermal layer. But this one is a little different in that the laser beam is shown, is given to the deeper parts of the dermis, of the skin only, to the fat layer as well as the dermal layer, and not the epidermal layer. So this kind of laser will affect the deeper parts, only the deeper parts, and the surface features will not be affected by this kind of laser. So if we do a tissue tightening procedure, see how much the fine wrinkling of the upper lip has improved, also on the lower lip as well. So we did a small study on 10 patients to assess how much improvement they get, and you can see how much the nasolabial fold has been improved, like more than 50% in this patient on the left side, and also she lost almost lower half of the nasolabial fold on the right side by deep laser treatments. And the other would be soft tissue augmentations, fillers, fat, and Botox. And one of the soft tissue fillers that we use is fat, your own fat. The supply is almost unlimited, and it costs nothing as compared to all the artificial soft fillers that we have to pay several hundred US$ per vial. The fat in your body is a generous supply of soft tissue fillers because it costs nothing. And I use fat grafting a lot for rejuvenation purposes, as well as to restore the contour of the face for disease-related atrophy and asymmetry. So you're injecting your own fat, harvesting the fat and injecting into deeper planes and more superficial planes in a very controlled manner. So this lady that I showed you before has several aging phenomenon that's obvious on her face, and this is after 8 months after one injection. You can see the improvement in the contour. The grooves has been improved, and the sharp grooves in the lower part of the nasolabial fold has been cleared completely, and you can see that the complexion, the color of the skin has become more regular after the fat injection. Fat not only restores the contour of the face, but it also secretes a lot of skin rejuvenating hormones. So it also improves the surface features. And this young lady was not happy with the deep grooves in her lower eyelid, which makes her look really tired. So I did fat grafts, about 3 fat injections, because the fats, the injected fat in this area has to survive without any blood supply. About 50% of the fat dies, and you lose the initial correction. If you look at yourself in the mirror after a week or 2 after the fat injection, you're very satisfied. But after a few months, about 50% of the fat becomes absorbed because they cannot survive the blood vessel avascular environment until the new blood vessels grow in. And so you have to do fat injections in serial. You have to give several serial injections of the fat in order for better correction. And this is 3 months after 1 injection. You can see significant amount of correction. And this is 3 months after 3rd injection of the fat. So she's very happy with the result. And this young lady had a very bluish color of the lower eyelid. And this is due to the very thin skin through which the muscle is, the eyelid muscle is showing through this very thin part of the skin. And this becomes more pronounced, the color becomes more pronounced with menstruation because the menstruation causes the blood vessels to swell up, and it causes more darkening of the color of the muscle, which shows through the skin. And in order to correct this problem, I put in very thin layer of fat between the skin and the muscle. And this is 1 year later after 2 injections. You can see that the contour of the lower eyelid has improved greatly and has become much better. And this elderly lady had, her right eye is okay, right lower eyelid is okay, but she had some irregular grooves here, and it was corrected with fat injections. And this gentleman wanted to look young at his son's wedding, which is about 6 months away. And he had very deep set upper eyelid and very, very saggy upper eyelid. And in order to address this problem, the usual blepharoplasty, which removes the redundant skin of the eyelid, will not be able to correct this deep set and tired looking appearance of the upper eyelids. So I initially do fat injections here, upper eyelid. And with 1 injection, it survives really well. And after this fat is all set in, I do upper blepharoplasty to remove the redundant skin. And this is about 2 months after the operation. And this is before and after. And he looks about 10 years younger now. And men who didn't have double fold in their upper eyelid are not happy with a very prominent double fold in the upper eyelid. So you can make it a little subtle. You can, of course, cut this a little more to elevate the upper eyelid a little bit more, but that will make the double fold more conspicuous. And other procedures would be to do blepharoplasty, the procedure that you just seen, and facelift and other surgeries. Other surgeries are used to rejuvenate. You can do brow lift, blepharoplasty, and cheek lift, and face and neck lifts. And this lady, this elderly lady, had drooping, sagging upper eyelid. And in individuals with a very thick skin, after direct removal of the skin, will damage the lymphatic system, and it may result in prolonged swelling of the upper eyelid after the surgery. So in this case, we can do blepharoplasty on the upper part of the upper eyelid, right below the brow, which will not affect with the lymphatic flow of the upper eyelid. This is immediately after surgery, and 3 months later, and this is about 6 months later. And this is before and after. You can see the curve of the upper eyelid has become much smoother, and she looks more rejuvenated. And it did not affect the swelling of the upper eyelid. And this elderly gentleman had really puffy upper and lower eyelids. So he needed upper blepharoplasty, lower blepharoplasty with removal of significant amount of the fat, orbital fat pads. And this resulted in this gentleman becoming significantly younger. And you can do surgical facelifts, but nowadays, more and more people want less demanding procedures, like less invasive procedures that will minimize the downtime. And this lady has been complaining about the sagging lower eyelid and the sagging cheek skin with a very prominent marionette lines. And she has been, her face has been lifted with threads, which is a semi-invasive procedure, and it's the downtime is minimal as compared to surgical facelifts. This is after 6 months. You can see the improvement in the elasticity of the lower eyelid, and you can see how much the marionette line has improved. This is after 1 year, and you can see how much the change, the improvement is maintained even long term. So take-home message from this talk is the prevention is very, very important. So the environment, you cannot do anything about the intrinsic factors, but you can refrain from smoking, and avoiding too much sunlight are the two factors that you can control. And of course, you can supplement anti-aging products and medications, and vitamin A topical application is one of them. And we have non-invasive procedures, a lot of like microneedling, and a lot of lasers, and the threads also, they can improve the aging features. And of course, surgery is the last mean. And it's very important to stop smoking and not go near people who smoke, because indirect, as you all know, indirect smoking is worse than direct smoking. And for the ethical issues in cosmetic medicine, there are many aspects in the ethical issues, and especially cosmetic dermatologists. It's mostly the people who has private practice, and they have to balance their lives between ethics and financial income. And they have to pay careful attention to duties they owe to their patients and public. They're not business people. They're doctors to begin with. They're doctors who helps the patients and benefits the public, and they get monetary compensation. And monetary compensation should not come forefront. And all the procedures have inherent morbidity, and the patients are not aware of the professional aspects of each procedure. So they rely almost completely on the doctors. And the doctors are given special privileges to perform procedures on the patients. And all this demand a greater degree of moral conduct on the part of the cosmetic surgeons. So it's not like business contract. And you have to keep in mind the cosmetic procedures are embellishments and life enhancing, and they're not life saving. So they're not essential to the patient for the well-being and to enhance the life-saving aspect of the medicine. And although the livelihood of cosmetic surgeons depend on performing the very procedures they recommend, so some doctors who are not so ethically inclined, they tend to recommend a little overly, unnecessarily to the patients for monetary compensations they get. But this should not happen in medical society. And so physicians engaged in cosmetic dermatology must attend to their professional obligations to patients and the public. They have to pay extra care. They have to exercise extra care for this aspect. If you look at this diagram, this cartoon, aesthetic medicine market share is most prevalent in North America and in Europe. So North America and Europe, they make up like more than half, about like more than 60% of the whole aesthetic procedures done in the world. But the Asia Pacific region is a growing market, as well as Latin America and other parts of the country. And if you look at the statistics from India, the growth in the size of the aesthetic medicine is phenomenal. It's astounding. Compared to 2016, I think this is due to COVID, a temporary phenomenon. People cannot travel, so they invested more in aesthetic medicine. But if you exclude this 2020, you have a very steady growth of the invasive and non-invasive procedures as well. So more people will be seeking help from doctors to make themselves look young. And there are many over-the-counter products, and a lot of them advertise in like aesthetic magazines, and they have questionable claims in questionable language. They say dermatologist proven product, but they don't specify which dermatologist and how many dermatologists backed up the product in what kind of study. If they did a clinical study on it, the background is very dubious. They don't give out specific information about that clinical study to the public. And one of the reporters asked the company rep. They called up the company, and that person asked in detail about the claims they made for anti-aging product, but they were all company secret, so they wouldn't give it out. So if a physician is a partner in an exclusive sale, like a product called Prevage, which is an anti-aging cream by Allergan, and Allergan is the company that makes Botox, so it's a very famous and very prestigious company. And this anti-aging cream is only sold at the hospitals through about 500 doctors in whole USA. So it's kind of a privilege to be able to buy this cream. And this is a marketing strategy to give more privilege to the people who can buy this cream. And it's not the quality or the effect of this cream that is scientifically proven, which gives the prestigiousness to this cream. It's the marketing scheme that gives the fame to this Prevage cream. So, and there are many doctors and many cosmetic physicians who manufactures their own cosmeceutical line, and it becomes ethically suspect, breaching obligations of beneficence and honesty when the cosmetic physicians trade on their status as a doctor to sell a clinically unproven product. And using the power of a medical degree as a marketing tool may, it may help you to earn more money, maybe more shrewd, but it's unethical if the product cannot withstand scientific scrutiny. And I know about a product which is produced by a pharmaceutical store, a company in Britain, UK. There's a store called Boots, and they have produced their own anti-aging serum product, and they put it under scrutiny. They gave the product to a group of scientists to prove the effect scientifically and objectively. And they did an experiment, and they reported to the British Journal of Dermatology, which is a very prestigious medical journal in the field of dermatology. And it got accepted because it was a well-controlled study. And they tested in 60 volunteers, and they used the vehicle only without the active component. And test product is their product, and they used the retinoic acid, the vitamin A product, as a positive control. Used it for 6 months, and they did the final assessment on the product, on the effect. And this is in vitro, laboratory proof that this product really works. And there's a connective tissue component, fibrillin, which is in the upper part of the dermis, and which becomes broken down as you age. And this is the control without anything. And this is after vehicle without active component application. And it doesn't make any difference between the control, negative control, and the vehicle application. But the retinoic acid positive control, you can see a definite area where the fibrillin is reformed. And this test product also is almost equivalent to retinoic acid in reproducing this fibrillin component. And clinical photo also shows that the wrinkle and the aging phenomenon has improved significantly, with the use of this product. So after this spread by word of mouth, people just flocked to Boots to buy this product. And for a while, the Boots had to restrict 2 tubes per each buyer, for each customer. So for the product that can be proven scientifically like this, it's okay, but it's okay to advertise it as it is. But for products which has not, which didn't undergo has been scrutinized by an objective scientific method, those kind of claims should not be made, and especially backed up by a doctor. And when you advertise yourself on the magazine or in like other broadcasting stations, people tend to puffer themselves up a little bit. So you have to reject personal buffering and ensure adequate and uniform training. And you have to be candid about your background um, to the public who has to choose an adequate doctor by accurate information. And you have to, as a physician, you have to fulfill an obligation to social justice. And if you're a dermatologist and if you devote yourself to too much cosmetic medicine, then the real real dermatology patients who has to see you for derm disease treatment will not be able to make an appointment for you. So even if you do some cosmetic procedures, you should not neglect the derm patients that really need your help and not focus on cosmetics only. So you have to be truthful in advertising yourself or the product. And be forthright about training credentials and do not emphasize tenuous school affiliations for the sake of marketing. And advocate for patients and maintain the integrity of the profession by demanding that companies deflate claims in their ads that imply that their products are scientifically proven, dermatologists endorsed, and generally better than they are. And continue to have a medical derm practice and volunteer those services, if not also the cosmetic ones, to those who cannot afford them. To give back to the society what you have been given. And terima kasih, and thank you for your attention.
Thank you very much, Professor Chang, for those great presentation with lots of information for all of us, I believe. There are already lists of questions.
Wow.
So, yeah.
I thought everybody had fallen asleep.
No, we have lots of questions. Let's start. So with the number one, Professor Chang, number one question, because I hope we get enough time to answer all of those questions addressed to you. The first question is from Mr. Azid. How do you differentiate between treatment and enhancement in the field of cosmetic surgery? And also he followed with the question, is a cosmetic surgery for treatment and enhancement is covered by the national insurance in your country, Korea?
Okay. The difference, I would say the difference between a treatment and enhancement would be the treatment is clearing up what you don't want. Like if you have an aging spot, you ablate it with a laser or you burn it up with the laser, and that will be a treatment. And if you have a deep set groove that you don't like, and filling up that groove with fillers or fat or lifting it up with a threads or facelifting surgery, it could be called an enhancement. And so enhancement is what accentuate what you already have. And treatment can be a very inclusive term, but it also means clearing up what you don't want, what was not there. And in our country, we have a national insurance system where like all the people are insured by the government national health insurance. But cosmetic procedures are not included. It has to be a out of your pocket.
What about if it's medical reason, like example, it affecting very much the mental stability of that young boy, for example, at your presentation? Will the insurance cover that? Because since it's not just he choose to remove certain thing or add, but it benefit his mental growth or other things?
The government is like like dubious on those areas. It's kind of a gray area. Um, if the depression is due to is a result of the disease, and if the patient claims, the government will give you reimbursement
Mm-hmm.
for the insurance. But if it's caused by aging or other, if you're not happy about your intrinsically depressed areas or intrinsically enhanced folds, then it's not covered by insurance.
I see. So if it's because of the disease that is
Mhm.
not your choice, then
Right,
the
right.
government might cover. Is that right, then, doctor?
Even for scars like
Mm-hmm.
keloid scars, if
Mm-hmm.
the keloid scar is small and it's in a hidden area, and if it does not cause too much symptoms like itching and pain, it's uh, it can be a cosmetic treatment.
I see.
Or if the keloid is in a visible area like your mandible margin, or if it causes too much pain, then
Mm-hmm.
it can be a insurance covered procedure.
I see. All right. Thank you very much for that answer. The first question from Miss Daisy Putri is that um, she's asking about the Korean artists like boy or girl, which are popular in Indonesia,
Mhm.
and seems like they look really, really nice, nearly like not real. And then, and then, is that uh, therapies or enhancement, in your opinion, in ethical perspective? And then, what about in general the idea from the Korean public themselves in the image that's presented by the celebrity over there? Because it's most people, the real people, do not have the luxury to have those
Mm.
face or enhancement.
Mm. I think it's an enhancement.
I see.
I definitely think it's an enhancement. They don't need any treatment. They're so young and they're good looking already, even before the procedure. But they want to look better. So I think that's definitely an enhancement. And
Mm,
it's not my preference. So if the patient want, well, patients don't come to me for those kind of procedures, but if they do, I would tell them not to do it, but because you already look beautiful in your own way. And
mm,
if you come to Korea and if you get on like buses or public transportations, you see advertisement for those kind of cosmetic clinics, and the all the before photos look different. They all have their individuality, but the after photos they all look the same.
it's
So
like they lose a bit of their characteristic of their face.
right.
Mhm, mhm,
So and I've heard some of the plastic surgeons giving lectures on the aesthetic aspect of the facial features. There's some features that they especially like, and they usually, depending on who the surgeon is, they eliminate some of the features they don't like, and they enhance the feature, or they create the features they want on the facial features. So
mm.
in the end, they're all like brothers and sisters in different plans, depending on
Mm.
who did the surgery.
Yeah,
So
look the
that's what I
same,
don't like very much.
similar.
Right.
Mm, I see. All right, and then those cosmetic surgery,
Mhm.
will the result last permanently? That's a question from Miss Rosa. And how long will they really last? Is it?
Depends on the procedure that you do, and depends on who does the procedures.
Mm,
But some can be quite temporary, like Botox, which will last about 6 months at most.
6 months to a year.
Yeah.
Mm,
So if the patients, if the patients want, immediate wrinkle removal in a very simple way, I give Botox, and actually giving the Botox in small doses twice a year is not really harmful. So
is it not harmful for long terms? Because every
no,
you
no.
need to inject.
Botox
Or,
has been around for more than 30 years now, and there's no reported incidences of long-term
effects.
harm done to the patient after small dose use twice a year.
And then they
So
can keep using it for, I mean, twice a year, like a treatment, like going to.
yeah, sure.
I see. All right. And then does the hormone therapy for postmenopausal women for the purpose of rejuvenating the skin cancer carried out in the long term will have also an impact on triggering some cancer, on the skin cancer?
No, not really. Not really. Even for Asian people, at least, we have done studies, very long-term studies on patients who had undergone UV therapy for certain diseases, and we use UVB or UVA, for therapeutic purposes for some certain diseases, and we have done long-term studies to see whether they are more prone to develop skin cancers after a prolonged UV therapy, but no. It doesn't. The long-term use of UV in a very controlled manner in pigmented people, it doesn't cause skin cancer. So hormone replacement is not a factor for skin cancer development.
Triggering the skin cancer, I see.
No.
And you mentioned on your presentation that we are very fortunate. The Asian skin has natural sunscreen, right? Although we must not take it for granted. But I would like to ask, how many do you think the percentage in Asian skin that you see the increasement of skin cancer patient in Asia, because our skin, the Asian skin, is remained the same 20 years ago, 30 years ago. Do you see an increasement in the in skin cancer? And then and what would be the cause of those increasement?
I think it's a complex, it's a play of complex factors that increase the incidence of skin cancers. And one of the factors is increase in outdoor activity and the increase in the lifespan. So we have more people in the elderly generation. And skin cancer is known to increase exponentially as you pass the age of 60. And in less than 20 years, in Korea, 2 out of 5 people will be more than 65 years old.
Wow.
So I think it's a problem in every country. Our birth rate here is like 0.7 now. It's a significant problem that younger generation are not getting married and they're not having children, even if they get married. So we're going to see more and more, and with development of medicine to increase their lifespan, we're going to see more increase in skin cancer.
I see, because they're affecting more and more to the elderly above 60, right, Professor Chang? I think the problem that you mentioned, the social problem, also not just faced by Korea, but the other developing country like Japan and Taiwan has similar social issue. Thank you. And the next one question is from Ms. Daisy. Is for clinical trial for a cosmetic, for example, the anti-wrinkle, has to be conducted in the areas only on the face, or it can be anywhere on the part of your body as long as the skin?
Well, most of the cosmetic products are for the face, but if you use a product on your whole body, it won't be too expensive.
I see.
Maybe too expensive, and it will not be the effect will not be too obvious. So most of the cosmetic products are centered around the face and neck.
On the targeted area of the, I
right.
see. All right. Okay, thank you, Professor. And then the next question is from Mr. Fajar. What is your opinion, Professor, about the effectiveness and the safety of the transconjunctival blepharoplasty? Do I pronounce it correctly?
Yes, yes. Very
Okay,
nice. Very
thank
nice.
you.
And it depends on the situation of the patient, because if the lower eyelid skin is too lax, if you have too much redundant skin,
Mhm,
the lower eyelid, you'll have
mhm.
to do uh, transcutaneous blepharoplasty and
I
open
see.
it up from outside right under the eyelashes and remove the redundant skin, as well
Mm,
as removing the excessively protruding orbital fat pads. But
mm.
if the laxity of the lower eyelid is okay, and if the patient is a young individual, we can leave the skin alone, and we can only remove the fat pad transconjunctivally. And
Ah,
it's a very simple procedure, which has a very short downtime as
mhm.
compared to the transcutaneous blepharoplasty.
I
It's a
see. But
very common.
usually you, yeah, usually you do it the bottom and the top at the same time, Doctor Prof, or separate
You can do it at the same time.
at the same time. I see. And
Yes.
then you would recommend it to do it at the same time.
Well, yes, because the downtime the patient is going to experience can be lessened to half if you do two upper and lower at the same time.
I see. So that it's safe on the downtime because it's
Mm-hmm.
all going to be swollen for some weeks, right, Prof?
Right, right. A week or
Before
two.
before it emerge beautiful and younger,
Right, right.
right?
It's going to
Well,
take some time for the
question
healing.
is, yeah, is that any food that is can help prevent aging? Because as you mentioned, even the most beautiful like those Audrey Hepburn or the Liz Taylor uh, cannot say no to aging. But is there any certain food that you know that can help prevent the aging or at least
Well,
slower?
I'm not an expert in that area. Well, we all have so much information on good food on internet uh, and publicly known products that can enhance your health. But I know some products that you should avoid because Elizabeth Taylor, uh, one of the favorite food, one of the two of the favorite food that she had was French fries and fried chickens. So I know
That's
that those two should be avoided, but
still
all the
looks
natural,
beautiful,
yeah.
right? And looking on. Yeah. All right.
So
So I guess it's depend, right?
right, right.
You eat them or how
Hmm.
often you eat certain food. I see. Thank you. And about that, now that you said that even when on the cloudy days, and
Hmm.
then still quite damaging to go directly to the sun, well, outdoor, even that it doesn't look really hot. And then
Hmm.
how often do we have to apply sunscreen? Then like because sometimes they say SPF, certain SPF, and it lasts whole day, 8 hours. Does it really last that long, or do you need to reapply it
It's recommended that you apply the sunscreen every 2 hours.
every 2 hours?
Every 2 hours. Hmm.
Okay, so those commercial brand that say that
Hmm.
lasting for 8 hours, we shouldn't take it just as
Well,
it.
it was that experiment was done under very controlled environments,
I see.
and in reality, people don't apply as much sunscreen uh, as recommended.
Mm-hmm.
You should use like a thumb tip sized amount of sunscreen on your whole face, but people don't apply that much. They use
Yeah,
very
exactly. They
sparingly.
put thinly.
Mhm.
That's right.
So for example, if it's SPF 50 product, by applying half of what was recommended, you lose the protectiveness. And
I see.
if you sweat and if you rub off your skin
Mm-hmm.
against some places, then you're going to lose the sunscreen in those areas.
So your advice is to reapply every 2 hours.
Yeah. Well, maybe if not every 2 hours, at least once after 2 hours.
Once after 2 hours. All right. Okay.
At least.
Yeah, and the next question is from Ibu Shafa. She mentioned that you, in your presentation, there is about the duty of the dermatologist to fulfill social justice. And the question is, how does this obligation is fulfilled if most dermatologist is limited to the rich people other than dealing with the poor? Is that anything possible for dermatologists to do an option for the poor?
Well, it depends on who you are. I mean, there are lots of opportunities for you to be involved in pro bono activities, even for dermatologists.
I know that you did a lot of those, Prof.
Well, not really, because I've been working in an institution for all my life. I rarely had chances to go to other places to practice, but there are lots of opportunities. There are lots of volunteer works that you can do in areas where you have clinics, people have clinics for the poor, and you can work pro bono, and you can
Like
do
the cleft operation, for example?
well, yes, for plastic surgeons, yes, and for countries like a lot of the African countries, for easy example, people go there for a lot of the volunteer clinics and like Doctors Without Borders. And in those tropical areas, there are lots of dermatology diseases, which is not treated and which is not serviced by the dermatologist. There are too little dermatologists in those
in
areas.
that country, so that,
Yeah.
you
So-
can, like, organization that organize dermatologists, a group of dermatologists to do some.
Or you can join a group of other doctors to give a holistic, help to the patients.
That's right. Thank you. And the next question is from Ibu Ria Tobing. How much is radiation that's using from computer and handphone whole day long is affecting the skin? Example, the radiation from the computer, like when we're Zooming nowadays with the COVID, we all conducting meetings and everything through our
Wow.
How is
Well,
it?
that's a very scientific question, but I'm afraid you're asking the wrong person, because I don't have the means to measure the radiation that comes out from the computer or cell phones.
I see.
Sorry,
So,
I'm sorry, I cannot answer that.
yes, that's okay, Prof. So now the next question, I hope there are more questions coming, Prof. Chung. So now I'd like to ask about the next question from Prof. Sophia, Prof. Rika. How about the stem cell therapy or its product, the non-cell therapy as anti-aging? In Indonesia, this regenerative medicine is very tempting. They said it has a good potential for repair. In many fact, many beauty salons provide this treatment for their customer. How is it the regulation in your country regarding stem cell therapy or other product as anti-aging therapy?
In my knowledge, stem cell therapy is approved by the KFDA in very, very certain areas, but not in cosmetic aspects. And there are lots of dubious products. It's very popular because if you advertise yourself as a stem cell specialist, or you're selling stem cell products that does this and that to your skin and your body, people tend to fall for it very easily because it sounds so scientific and it sounds so advanced. But in fact, it's not. I've tested several products that were produced by the stem cell cultivations, and one of the products was for the scalp, for the hair regrowth, and the other products were to improve the skin quality. But the the claims that the companies made were not proven scientifically, so we abandoned those products. We did not give our endorsements for those for financial reasons. And there should be a lot of products which should be the same. I think more than 90% of the products that are advertised such will not have those effects if you give them under, if you put them under scrutiny. So you have to be dubious at first and look for really objective and scientific background for those products. And if you're not sure, call those companies for those kind of proofs. And if they're not willing to give out those companies' secrets, then just discard. Don't believe them. If they are able to give you, objective reference, like those article in BJD that I just showed you, then you can believe in what they say. But if not, it's not good to believe, even half of what they say. Is Ms. Piri offline?
Yes, I'm sorry. It was the connection was
Okay.
bad, so I give him a few minutes. Yeah.
Okay,
The
I
next
hear you.
question. Yeah, can you hear me, Professor Chang?
Yes, I can hear you.
Yeah,
Loud
the
and
next
clear.
question, is can you kindly share your opinion on the dermatologist's moral duty or responsibility with regards to the content influencing the construct of standard of beauty in society? That's from Dr. Wika.
Wow, this is a very philosophical question. I think we can talk about this for hours on this specific subject, but I think dermatologist's duty on this aspect, in terms of beauty, will be equivalent to all the doctors' moral duty in aspect of health in our society.
So patient first, right?
Yeah, the patient first, and always be objective, and always back your assertions with objective scientific background, and put the monetary compensation last, and put the patient and the public first. And even if you don't run for the money, you're going to be able to survive as a doctor. So it's not about, everything's not about zeros. No.
I see. Thank you. And there will be a question again. What's the long-term effect of applying vitamin C serum? Because it's very often we saw advertising. We have to put now vitamin C. For a few years back, it was vitamin A. Now everybody say the serum of vitamin C. So what is the effect?
Vitamin A is still alive. It's not a fad that passes away, but it's scientifically proven that vitamin A.
Hello?
No, you're muted, Prof. Chang.
Prof. Chang?
Oh, can you hear me now?
Yes, we can hear you.
Okay, I didn't touch anything. I don't know why I was muted. Maybe because I'm talking too long.
No, Prof. Chang. Yeah, go ahead.
Vitamin C molecule is a large molecule, and normally it cannot penetrate the skin. So we used to use a procedure called Iontofluorescence, where we use a electrically charged probe to electrically literally push the vitamin C into the skin. And I'm not sure if they have more penetrating product now for the vitamin C, but I think vitamin A has more solid background in improving the skin aging features. But I do recommend the patients to take vitamin C with a product called Rutocide. Rutocide is a antioxidant that's extracted from buckwheat.
Buckwheat, I see.
Yeah, buckwheat noodle is very popular in Korea and in Japan. And there's an antioxidant called Rutocide, which is extracted from that buckwheat. And combining vitamin A, vitamin C, and Rutocide, it's like a nutrient that you take every day. It strengthens your connective tissue. So I usually recommend it to elderly people who bruise easily. With aging, you lose the elasticity and resilience of the dermis, which contains the blood vessels, the capillaries. And because the capillaries become fragile, minor trauma or slight rubbing of the skin causes bruising in those areas. And if you take vitamin C and Rutocide as a nutrient supplement for several months, the bruising becomes much less. So that's the supplement that I recommend to elderly people. But I don't know about the topical application of vitamin C.
I see. Thank you, doctor. Now there's
and it's too expensive.
Too expensive, right? Now we have a few more questions and we have 12 minutes. So I'm going to give and pick two last questions from Peter John. To what extent, from Peter John for Professor Chang, to what extent the purpose of the anti-aging treatment could influence the ethical ground of the procedure and ethical or unethical?
Oh, this is a very, very
hard
difficult question. Yeah, it's a very difficult question. For some people who are mentally strong, aging will not affect them, not affect the integrity of their mentality. But for people who are more concerned about their external features, and they may lose their self-confidence with aging.
With the aging,
by giving them minimum amount of anti-aging treatment and restoring youthfulness to those patients, we can enhance their mentality and we can boost up their morale. And I think it's ethical to help the patients in that way. But recommending the patients to undergo unnecessary procedures or charging them astronomical amount of money for the procedures that will make them look like some of the Hollywood stars, all bloated up. I think it's very unethical. So it's like two sides of a coin, and it's like a two-bladed sword. And how you use it, how you wield the sword, depends on the person who holds the blade. So the doctors have to be trained and they have to be educated to follow the path which will, prevent them from veering off that path that Hippocrates laid the foundations on. So depends on the person, really. But I think helping the patient physically and mentally makes the aesthetic medicine, it gives a credibility and justice for the aesthetic medicine.
I see. Thank you for your answer, Professor Chang. And your time, I know your time is very tight, and in Korea the time is ahead of us. We would like to wrap up this, and then we thank you for your time and your presentation. I would like to invite the director of the
Center of Bioethics, Ibu Siwi, to say a few words before we close the session. Ibu Siwi, are you there?
Yes, Mbak Puri. Thank you very much. Yeah. Thank you very much.
Our director, Ibu Siwi.
Yeah.
And also
newly appointed, actually. Yeah, thank you very much, Professor Chang, for a very interesting and information and discussion. And I think so many questions. Actually, we will have so many questions if Mbak Puri doesn't stop the time, yeah, for us to stop the discussion. Well, I think we have learned so much also from you about the ethical problems of dermatologists. Actually, I saw here so many also dermatologists. Yeah. And then also, I hope that we will have another session with you in the future. Mbak Puri, maybe you can arrange that. Yeah, because we actually have a weekly session for the bioethics and medical humanities. So Gadjah Mada University has been appointed as UNESCO chair for bioethics, and this is one of the activity, the activities that is for the UNESCO chair for bioethics in Indonesia, and actually in the region, also in Asia Pacific, I think. So this is the one of the activities. Thank you very much, and I think we will. I think Mbak Puri also would like to arrange something, yeah, for the next or for the future, yeah, because there are so many things that we can actually discuss. Right. We hope that we will have an, for instance, an exchange or information or research, maybe, yeah. So yeah, thank you very much once again. We are very grateful. And to announce for the next week meeting, we will have Dr. Muhammad Rizky Nur Karim from University of Indonesia, and the moderator, Dr. Nur Azid Mahardinata. We are going to talk about, yeah, this is very basic, I think, COVID-19 pandemic utilitarianism and the absurd theory, the analysis of ethical dilemma. So this is actually really about bioethics and ethical dilemma, but we usually talk also about medical humanities in general. So back to you, Mbak Puri. Thank you.
Thank you, Ibu Siwi. Prof. Chung, we just like to thank you once again. Actually, Center of Bioethics has been actively trying to spread bioethics in Indonesia. It's still, I would consider also the few years ago, it's been started by Prof. Narto and Prof. Yati, but the development of the study of bioethics only began 3 years ago. The University of Gadjah Mada is the first faculty of medicine that teach bioethics. So now we are on the 3rd year of accepting students studying bioethics. So we thank you very much for your time and for your support, and in helping us learning as much as possible, not just from a medical bioethic, but also from in your specialization skin, and how is the ethical issue that is can arise from the dermatology. Thank you, Professor Chung. Would you like to say a few words before you say goodbye?
Thank you very much for your invitation, and I greatly enjoyed it. I usually don't talk about bioethics, especially the ethics of the aesthetic medical field, but this was a very useful opportunity for me to round up my thinking and discuss about it with the specialists in Indonesia. And thank you again for inviting me.
Thank you, Prof. Chang. And then we hope to see you again soon, one day, or via Zoom, like Ibu Sri said. With this, maybe we can't fly too fast to Korea, or you cannot come and visit us, but sure, one day.
One day, yes.
One day. Yeah.
Thank you,
Okay.
Prof. Thank
Terima
you.
kasih.
Thank you very much.
Thank
Terima
you,
kasih.
Prof.
Yeah,
Chung.
yeah.
Thank you very
Thank
much.
Thank
you.
you.
Thank you.
We had 100
Bye.
participants. Prof.
Yes, Prof.
Thank
We
you,
have
Professor.
Oh,
Thank you, Prof.
100 participants.
100.
Yeah.
Thank
Okay.
you, Dr. Puri. Yeah.
Thank you, Mbak Puri.
Thank you, Prof.
Thank
Chang.
you, Mbak Puri. Thank you.
Mbak Puri, thank you,
Excellent.
Mbak Puri. Thank you, Bu
Excellent.
Sivi.
Suara.
Thanks.
Ini
Suara oke, bagus.
enggak suaranya video tadi. Videonya kok nggak ada suaranya.
Oh iya.
Oh ini, oke.
Selesai nih. Terima kasih semua. Bu Sivi.
Terima kasih, Prof.
Ya.
Terima kasih, Bu
Terima
Sri.
kasih.
Terima
Thank you.
kasih.
Bioetika itu lahir
kasih.
dari etika kedokteran ya.
Thank you,
Jadi
thank you.
lahirnya sebenarnya dari etika kedokteran dan dalam banyak hal prinsip-prinsip bioetik itu berasal juga dari prinsip-prinsip medical ethics gitu ya. Masalah-masalah itu hanya bisa diselesaikan dengan ilmu bioetika. Justru disinilah ada suatu rangkaian yang sangat erat antara ilmu-ilmu kedokteran dan juga ilmu etika yang akhirnya disatukan menjadi bioetika. Karena kalau kita itu bicara mengenai bioetika, kita itu berbicara sesuatu yang real dan nyata. Ini mungkin berbeda dengan pembicaraan kalau kita di Fakultas Filsafat, di mana orang berbicara tentang etika, misalnya begitu ya, atau filosofi pada umumnya, mereka lebih spekulatif. Bioetika akan memberikan pencerahan atas dasar apa, atas dasar rasionalisasi apa, sehingga yang ini harus diteruskan, tetapi yang lainnya tidak. Ketika kita bicara mengenai bioetik, kita tidak berbicara yang terlalu
Sudah Mbak Dewi. Sampun nggih. Oke,
Terima kasih Bu, Prof.
Ya, terima kasih. Ya, baru didengarkan tadi soalnya sebetulnya.
Masih koma ya kayaknya. Masih
Iya,
koma.
belum selesai, belum titik.
Titik koma.
Ya,